Okay, one more
तो
time.
ये
one more
हमारी
time.
पेशेंट
Really sorry.
आई हैं. शी हैज़ कम ऑल द वे फ्रॉम यूएसए और ऑपरेशन कराना आई थी एंड वी हैव ऑपरेटेड हर लेफ़्ट फुट. आप इनका लेफ़्ट फुट में थोड़ा सा ध्यान रखेंगे तो इनका पूरा फुट ड्रॉप हुआ हुआ है. ये अपना
Thank
पैर
you,
ऊपर
thank
उठा
you.
नहीं पा रही हैं.
Yeah, can you show your movie?
हाउएवर हर इनवर्ट मूवमेंट्स आर प्रीटी गुड एंड क्योंकि इनवर्ट मूवमेंट्स अच्छे हैं और डाउनवर्ड मूवमेंट्स भी ठीक ठाक हैं, सो वी आर प्लानिंग फॉर द सर्जरी इन दिल्ली. इनको दिल्ली में हमने ऑपरेट करा है एट मैश हॉस्पिटल. हालांकि अपवर्ड मूवमेंट देयर इज़ ओनली अ फ्लिकर ऑफ अपवर्ड मूवमेंट्स प्रेजेंट बट इट्स नॉट देयर. हाउएवर द गुड थिंग इज़ दैट हर डाउनवर्ड मूवमेंट्स आर प्रेजेंट. तो हम लोगों ने इनका ऑपरेट करा था. ये आप देख रहे हैं कि टिबियालिस पोस्टीरियर टेंडन है. द टिबियालिस पोस्टीरियर टेंडन वाज टेकन आउट एंड आफ्टर पासिंग इट थ्रू द टिबियालिस एंटीरियर टेंडन. हम लोग दो टेंडन्स यूज़ करते हैं यहाँ पे, टिबियालिस एंटीरियर एंड टिबियालिस पोस्टीरियर. द टिबियालिस एंटीरियर टेंडन जो नीचे की तरफ है वो सपोर्टिंग टेंडन की तरह एक्ट करता है, और ये टिबियालिस पोस्टीरियर टेंडन जो होता है दैट इज़ द मेन टेंडन विच इज़ वर्किंग फॉर एलिवेटिंग द फुट. और हम आपको अभी दिखाएंगे कि टेंडन कहाँ पे किस तरह से बोन में घुसता है. आप ये देख रहे हैं, दिस इज़ द टेंडन विच वी हैव फिक्स्ड. ये टेंडन ने फिक्स कर दिया है हम लोगों ने. ये टिबियालिस पोस्टीरियर टेंडन है जो इनका काम करेगा. और ये कहाँ पे जा रहा है आप लोग अच्छे से देख रहे हैं कि ये आप जो देख रहे हैं स्क्रू है, जो आप होल देख रहे हैं दैट इज़ द स्क्रू विच वी फिक्स, और टेंडन आपका बोन के अंदर जा रहा है.
स्क्रू देख रहे
सो दिस इज़ हाउ वी फिक्स द टेंडन.
सही है ना?
ये स्क्रू आपको दे वाइट वाला जो स्ट्रक्चर है वो स्क्रू है, और साइड में जो टेंडन है जिसमें आप थ्रेड्स देख रहे हैं दैट इज़ द टेंडन. Started? Okay. Hi, this is Dr. Adnan Feroz and I'm a consultant orthopedic surgeon. Today we have a patient who has come all the way from USA. ये patient हमारी US से आई हैं and she had a problem in her foot. It was a left foot which was completely dropped. It basically we tell in medical terms we basically say it's a foot paralysis. और अगर हम लोग जो बहुत से patients जानते हैं इसको, वो foot drop कहते हैं इसको. It was a left foot, Tilak?
Yes, left foot.
Tilak is basically not the patient, but he is the husband of the patient. And तो उनको जो है प्रॉब्लम करीब 2 साल से हुई थी. 2 साल से उनका फुट कम्प्लीटली पैरालाइज था. शी ओनली हैड अ डाउनवर्ड मूवमेंट्स, और इनवर्ड मूवमेंट्स अच्छे थे इनके. Downwards and inward movements were pretty good, and for 2 years she was showing to a few doctors in US. US में आप you had shown to some doctors.
Yeah, we have shown it to a couple of doctors, but nobody gave us any confidence in terms of treatment.
Okay.
The entire focus was on her nerve, which got damaged 5-6 years ago.
Basically, they were mainly focused on the diagnostic part, not in the management
not
part.
in the management part of it.
They also did a biopsy, the nerve.
Yes, they did a biopsy 10 years ago just to make sure that there is nothing serious, any kind of underlying condition.
But that didn't help.
Yes, everything came out true. Okay. But after a while, then she started developing this stomping while walking, which is very noticeable. And then she started doing physical therapy, where she was made some exercises to get her movement back in the big toe and all. During that time, the physician over there has recommended that something like this is possible, where then she started looking around and ran into Dr. Adnan.
Then we basically
obviously showed everything on the YouTube, and that's how we got.
So basically इनको जो problem हुई थी 2 साल पहले, for unknown reasons, बहुत से patients में reasons are not very known, she started having weakness in her foot. The weakness, the foot में which was happening was gradual or was all of the sudden?
No, it was gradual. It was progressive for a period of 2 years. Yeah.
So in a period of 2 years, 2 साल के अंदर जो weakness शुरू हुई थी, she started having weakness in the lifting of her foot upwards. ये ऊपर नहीं जाता था आसानी से. However, the good thing was that उसके नीचे के movements, patient के और downward movements were preserved. मुझे लगता है I don't think there was any weakness in those movements.
No.
So for the past 2 years, those movements were preserved. लेकिन जो मूवमेंट्स प्रिजर्व नहीं थे वो ऊपर वाला मूवमेंट प्रिजर्व नहीं था. दैट इज व्हाट वी कॉल एज अ फुट ड्रॉप, एंड द फुट जस्ट स्लैप्स डाउन एंड द पेशेंट हैज अ स्लैपिंग गिट. प्रॉब्लम हम लोग if at all the weakness is increasing the downward and inward movements, then we really don't operate these patients. We have to wait for a while. अगर कभी भी पेशेंट्स में ये वीकनेस नीचे के मूवमेंट्स में आने लगती है या साइड वाले मूवमेंट्स आने लगती है, तो हम लोगों को ऑपरेशन करना मना होता है, क्योंकि then the operation results will not be good enough.
Yes.
Okay. But we have to always see this in the history that these movements are preserved for the past 1 year, as you were saying.
Yes.
And that is the reason why we went for the operation. The operation went fantastic. Operation बहुत अच्छा हो गया as expected. हम लोगों ने एक आपको वीडियो दिखाया भी था चलने का किस तरह से है. एंड द प्लास्टर हैज़ बीन अप्लाइड और करीब 6 हफ्ते बाद हम लोग इनका प्लास्टर हटा देंगे and we'll see the results, how the results turn out to be. I'm really thinking positive results to be happening. Tilak, you came all the way from US.
Right.
I really want to thank you first for having believe in me.
Sure.
Okay. मैं दिल से शुक्रगुजार हूँ आपका कि you had that much trust and you coming from US because you know these places and they've come here and you know we all interact with them. That's what I was thinking that when we interact in all these foot conferences, you know these guys come from US, from UK and all, we all sit together, we have a chat. So they do all these surgeries, but by chance or by coincidence, we just went to some other place and things didn't happen rightly. Not an issue at all. That was a good thing for me. we met each other.
Right. No, I also want to say a few words. Right when my wife first initially spoke to you about her condition, and then she was really hesitant and reluctant to have any kind of needle on her body. But then when I got an opportunity to talk to you for the first time, all I can tell is you gave us instant confidence, and we felt home even before coming here.
Definitely.
And we knew that we are going to be in good caring hands. And the experience was really good all along so far. And your smile is infectious, so please keep it on.
But, always keep smiling. We all have to keep smiling. All have to keep smiling and always be happy. No matter what problems take place in life. That is the main motive. Like we always have to be happy because at the other end, there are a lot of people who are suffering more than us. Get it?
No, it's very rarely it happens that when you speak to a doctor, you get that confidence, but you definitely gave us that confidence booster in the first call itself. And thank you for taking care of us.
Thank you for trusting us and trusting this hospital. Mesh Hospital was good for you?
Yeah, everything is
not
fantastic.
Problem at all. Everything was very smooth here.
Everyone is good. All the hospital staff, their hospitality, everything is spot on.
So Mesh Hospital is known for its hospitality, for the standards which it's providing. We have the operation theaters and everything is at par, and things are absolutely fine here. There are no waiting periods here for the patients. The patients immediately can get admitted here. They get immediate treatments here, and that's the reason why I always choose Mesh Hospital for all my patients. Majority of my patients who are not able to come to my hometown and want to get operated in Delhi. So that was a short story, and उम्मीद है ये सब वीडियोस आप लोगों के लिए बहुत हेल्पफुल होते हैं. ये एक शॉर्ट हिस्ट्री थी हमारे पेशेंट की, एंड हु हैड कम ऑल द वे फ्रॉम यूएसए. और I again thank you, Tilak, that trusting on me and getting the surgery done is a big happiness for me, and you know that people can trust on basis of only a few videos.
Absolutely. Now feeling is mutual.
Nice. Thank you so much. Thank you for watching the videos. Thank you.
So it has been 6 weeks since the operation, और 6 हफ्ते हो गए ऑपरेशन के बाद. इनका प्लास्टर हमने 2 दिन पहले ही हटाया है, और आप लोग देख सकते हैं इनका हल्का सा मूवमेंट आना शुरू हो गया है. You can see, if you look carefully, that you can see slight movements have started taking place. The tendon which has been incorporated, which has been transferred, has started working. 6 weeks बाद ये movements इतने ही रहते हैं. There are slight movements in the initial period of the plaster removal, but as time progresses, the movements will definitely increase. The main thing is that the tendon has started working. इनका tendon काम करना शुरू हो गया है, और आप लोग अगर बहुत ध्यान से देखेंगे तो इनका मूवमेंट हल्का हल्का ऊपर जा रहा है पैर. इनका एक चलने का वीडियो हम देखेंगे अभी. So as you can see, the way she is walking, initially she was walking with a drop foot, but now she is able to lift her foot upwards. Focus on the left foot, since we have operated the left foot of the patient. आप लोग अगर लेफ़्ट फुट को देखेंगे तो इनका लेफ़्ट फुट जो पहले ड्रॉप था वो अब ड्रॉप नहीं है. शी इज़ एबल टू कंट्रोल द dorsiflexion movements, and with time I'm definitely sure she will be better. Thank you for watching all these videos, and I hope these videos are really helpful to you guys. उम्मीद है कि जितने भी वीडियोस मैं पोस्ट करता हूँ आपके लिए काफ़ी हेल्पफुल होते हैं, और आप लोग कभी भी इन नंबर्स पे जो आपके सामने कांटेक्ट करके हमसे अपॉइंटमेंट बुक कर सकते हैं. थैंक यू वंस अगेन.